You know that feeling, right? That little shake in your hand, that jittery sensation. We've all been there. But have you ever stopped to wonder what's actually going on inside our bodies when a tremor takes hold? Well, today we're going to unpack the science behind the shake. Yeah, whether it's from nerves right before a big speech or maybe, just a little too much coffee, that quiver in your hands is something pretty much every single one of us has experienced. And honestly, it's the perfect place for us to start our deep dive today. So it turns out that common, everyday shake actually has a medical name. It's kind of the baseline tremor that affects, well, virtually all of us. So let's get to know it a little better. Okay, so this is called a physiologic tremor. And the key phrase to hang on to here is not normally visible. Get this tremor is always there. It's like this tiny, constant oscillation in our muscles, kind of like background noise. We just don't notice it until something comes along and cranks up the volume. So what exactly cranks up that volume? Well, it's the usual suspects. Anxiety, a big jolt of caffeine, even certain medications can do it. What's happening is that these triggers are flipping the switch on your body's sympathetic nervous system, the whole fight or flight response. But here's the most important takeaway. This kind of tremor is a totally normal response. It's not a disease. But, okay, beyond that everyday physiologic tremor, there's a whole spectrum of other types. This is where clinicians have to be really systematic, because as we're about to see, not all shakes are created equal. Not by a long shot. Just to give you a taste, for example, you've got something called essential tremor, which is actually the most common cause of what's called an action tremor. Then you've got cerebellar tremors, which are tied to the part of your brain that handles coordination. There are even orthostatic tremors that only pop up when you're standing. And of course, there's the one many people think of first, the Parkinsonian tremor. So, with all these different types, you might be wondering, how on earth does a doctor figure out what's what? Well, the single biggest clue is all about timing. It's not just that you're shaking, it's when you're shaking that really matters. And that right there brings us to the most fundamental divide in the entire world of tremors. The huge difference between a shake that shows up with action versus one that shows up at rest. So here are the two big buckets. You've got your action tremor, which, just like it sounds, shows up when you try to do something, like lifting a glass to your mouth. And then you have the rest tremor, which pops up when the muscle is totally chilled out and relaxed. And here's the crazy part. It often vanishes the second you actually try to use that hand. Okay, let's put this into practice and compare two really common but totally different tremors. So essential tremor, that's your classic action tremor. It's the one that can make simple things like writing or drinking from a cup a real challenge. Parkinson's, on the other hand, is the textbook example of a rest tremor. But look at the other clues, too. Essential tremor usually hits both sides of the body, while Parkinson's often starts on just one side. And here's a really fascinating little detail. For many people, essential tremor actually gets better with a small amount of alcohol, but a Parkinson's tremor doesn't change a bit. All right, that comparison really sets the stage perfectly for us to zoom in on Parkinson's. We're going to unpack the specific clues that help point a clinician toward that diagnosis. So put yourself in the clinician's shoes for a minute. A patient walks in and you see they have a tremor, but only when their hand is resting, and it's only on one side of their body. That single observation immediately starts pointing you down a very specific diagnostic path. So what are the big telltale signs? Well, there are 4 classic features. Number 1, it happens at rest. Number 2, it often has this really unique pill rolling quality to it. 3, it starts asymmetrically on one side. And number 4, here's a curious little detail. The tremor often gets worse when the patient is distracted by something else. So what in the world is pill rolling? Okay, I want you to imagine you're rolling a tiny little bead between your thumb and your index finger. That specific circular movement, that's it. It's a very, very distinctive kind of motion. Okay, so we've covered the what, the symptoms and the signs, but now let's get to the why. What is happening deep, deep inside the brain that's causing this very specific kind of shake? Really, at its absolute core, it all comes down to a communication breakdown. Think about it. The brain has this incredibly sophisticated system for making sure our movements are smooth and controlled, and it relies on a clear chain of command. In Parkinson's, that chain of command gets broken. Here's how that pathway is supposed to work. First, you have the basal ganglia, which gets the ball rolling and smooths everything out. It sends a signal to the thalamus, which is kind of like a central relay station.
The thalamus then sends those refined instructions on to the motor cortex, which gives the final order to move. So basal ganglia to thalamus to cortex. It should be a clean, seamless signal.
Now, in Parkinson's disease, the problem starts right at the beginning of that chain. That first signal coming from the basal ganglia gets all garbled. And from that point on, the rest of the pathway is basically forced to work with bad information. And the end result of that faulty signal? A tremor. And here's the biological root cause of that disruption. It's the progressive loss of special cells, dopamine-producing neurons, in a place called the substantia nigra, which is just part of the basal ganglia we talked about. Dopamine is an absolutely critical chemical messenger for motor control. So as these cells disappear, that messenger goes away, and that's what leads directly to the physical symptoms of the disease. So when you think about it, from a simple nervous jitter all the way to the complex signature of a neurological condition, a tremor is so much more than just a shake. It's really a window, a fascinating window, into the intricate, hidden workings of our brain. It makes you wonder, right? What other subtle signs might our bodies be showing us about what's really happening on the inside? Thanks so much for joining me for this one.